Hello and welcome to this video on ethics and current issues in counseling. I'm Kristen Kinsevich, a doctoral student at Regent University in the Counselor Education and Supervision program. This video will cover the ACA Code of Ethics and will go section by section, covering the counseling relationship, confidentiality and privacy, professional responsibility, relationships with other professionals, evaluation and assessment, supervision, training and teaching, research and publication, distance counseling technology and social media, and resolving ethical issues. We'll also discuss current issues in counseling. In Section A, the ACA Code of Ethics begins by talking about the counseling relationship. Our first priority is to maintain client welfare, to keep them from harm and to care for them. We want to obtain informed consent and obtain releases. And in fact, the ACA Code of Ethics encourages collateral contacts by really utilizing the client support system. We want to avoid harm, and we also want to avoid imposing our values onto clients. We need to maintain boundaries in the counselor roles and the relationships. And you'd have to read the specifics of the Code of Ethics if you want to know more. This video is just giving an overview, but I think there is a general understanding that a counselor's role is limited by a certain location and time frame, certain roles that a counselor can play in a person's life, certainly also like financial involvement and various things. And so we want to keep that counseling role kind of limited to the one area of being a counselor and meeting in a certain defined space and time, and keeping that relationship as free from other aspects as possible. We also see in Section A that there is really an encouragement of advocacy work, some recommendations about group work and how to manage that, and also how to manage referrals for multiple clients that may have a relationship, such as friends or family members, how to provide appropriate referrals in that case. It also covers fees and business practices. Obviously, we want to aim to not be exploitive in our practices. It talks about termination and referral and avoiding client abandonment. In Section B, the Code of Ethics covers confidentiality and privacy. Clients have rights, and certainly by law, we know that HIPAA is another aspect of clients' privacy rights. And so we have to respect all of the rights that clients have. We are mandated reporters, and so Section B covers some exceptions to confidentiality in the case of mandated reporting, and also talks about information sharing. Obviously, you want to get assigned authorization and release for information if you're sharing any kind of information about the client. Obviously, you want to maintain good records and documentation and maintain the highest standards for those documents. And you want to protect client privacy in consultation. So if you meet with a peer for peer supervision or consultation, that you would not share names or identifying details on that client. Section C outlines professional responsibility, and it is our job to seek and maintain competence. And really, there's an emphasis here on diversity. It is not acceptable to simply remain incompetent in a certain area and kind of just refer people that you don't prefer to work with. There needs to be truth in advertising and solicitation of clients. So we have to accurately represent our credentials, as well as not exploit scenarios where we could maybe solicit clients. This non-discrimination idea, again, is this concept that we're not allowed to refer just based on not wanting to work with a certain population. Now, obviously, counselors do sometimes specialize in, let's say eating disorders or working with children or adults. And that kind of very broad category is acceptable, and because you can't be trained as an expert in every single area necessarily, but in terms of more narrow areas kind of that would fall under multicultural competencies, we do need to maintain competency in that way. And of course, we want to do no harm and contribute to the public good, which would involve doing pro bono work or advocacy And so that's part of our profession and our ethical responsibility. Section D talks briefly about relationships with other professionals. And really here it's just the point of respecting other approaches and disciplines and being willing to provide consultation when it's sought out. In Section E, they cover evaluation and assessment. And really we need to make sure that we're using assessment tools according to our level of licensure and competence. So using only the tools that we've been trained on and are licensed in accordance with their guidelines of how they're supposed to be used. We need to use care in diagnosis, certainly be intelligent and knowledgeable and cautious in the way that we're diagnosing. We want to also be cautious when we're providing assessment in legal proceedings and just take a lot of care to do that ethically so that we don't harm someone in a process of a forensic issue, for example. Section F talks about supervision, training, and teaching. Again, we need to keep in mind client welfare here. It is always making sure the clients are doing well and taken care of. And so if your supervisees are working with them, you are responsible to make sure that the clients are being treated properly and taken care of. We also need to practice in our areas of competence. So you can only supervise in areas that you have practiced in, and you want to also make sure that your supervisees would only practice kind of within their levels of competence, meaning obviously they're growing in their competence, but that they're receiving adequate supervision for the kind of work that they're doing. There are certain supervisory or educator roles and relationships that have boundaries similar to the client and counselor relationship, and so we need to keep those in mind. Interns or supervisees should disclose their status or training levels so that it's clear what level of licensure they are at, or if they're still in a graduate program, that they should disclose that. It is our responsibility to evaluate and practice gatekeeping for the profession, and we'll talk about that in a little bit. But that is one of the roles that supervisors and counselor educators have. We also need to make sure we're including multiculturalism and ethics throughout a curriculum of counselor education. And so that is an important, not sectioning those off into their own classes, but really weaving them throughout to help promote diversity and ethical practice. And obviously, we also want to be mindful of student welfare. We want to make sure that our students are doing well and taking care of themselves and not being harmed in any part of their process of training. In Section G, it covers research and publication. And we want to keep in mind that research participants have rights as well, and we want to respect those rights. We want to maintain boundaries with our subjects and not have dual relationships with them. We want to obviously provide accurate reporting of results when we have research or publication. And we want to avoid plagiarism and protect identity if we give case examples in research, that it would not be identifying information. Section H deals with distance counseling, technology, and social media. And if you are doing distance counseling, that does require you to gain some competency in that area. There are trainings out there that would enable you to be competent to provide that. There are some additional ethical guidelines and kind of standards of practice that we need to be aware of. We also need to follow state laws, so you cannot practice outside of your state that you're licensed in. And the state that is considered to be the one that's being practiced in is the location of the client. So I am licensed in Massachusetts, and so I could not work with a client who is currently in Connecticut, even though I might still be in Massachusetts. It's the client's state that matters, and so you have to be aware of your state laws and follow them. We need to gain informed consent and also client verification in distance counseling. So we want to make sure that we actually know who we're treating and that we've verified that in some way and that we know where they are when we're providing that distance counseling. In case there was an emergency, we needed to call for a well-being check or something like that, that you would have that information. We want to make sure that we are compliant with all the laws around what tech platforms are allowed, and certainly HIPAA would speak to that. There are rules about not using, Skype or Google Chat or things like that, but using secure platforms. And also for social media relationships and content, it's important that we not have electronic or social media relationships with our clients, and that we are careful in what content we post that would be made public in some way. One good idea is to maintain a professional page, so that if clients want to get more resources or things, they can follow you on those public platforms, and that would be strictly kind of your professional counselor identity that's being displayed there. Finally, Section I is about resolving ethical issues, and it's really important to know the ACA code, to document all of your decisions that you make that maybe are in ethical gray areas. There is a process for informal and formal resolution of ethical violations. If you're able to informally resolve an ethical violation with the provider or the clinician, then that is better. But if that's not possible, then certainly filing with a state board would be a way to handle an ethical violation. And obviously, if there's ever some kind of ethical charge brought against you, that you would cooperate with ethics committees, that you would not attempt to stonewall that in any kind of way. There's other ethical codes out there, and you can compare them. The NBCC has their own code of ethics, which is less robust than the ACA Code of Ethics. So that's why I chose to highlight the ACA code in its entirety. The AACC Code of Ethics is used with Christian counselors, and that, again, it has a lot of similarities, but there are some differences specifically related to kind of how to manage certain areas of values conflict. And so that would be important for you to take a look at if you are a Christian counselor. Current issues in counseling, and we'll end on this slide. There are a few things that the NBCC is working on or has highlighted in recent advocacy work. Gatekeeping and remediation is one that I think this article by Batt in 2005 is very helpful if you're looking for, what does gatekeeping mean and how do I do it ethically and legally. This article presents 5 models, and they're really clearly defined, which is very helpful. And really, I think it's important to keep your process simple. But if you are working either supervising an intern or, a counselor educator, overseeing a program, that you have really just clear guidelines. And they encourage in this article keeping it simple, not having excessive amounts of kind of protocols, but at the same time making sure that every student is evaluated on certain measures. And they also encouraged basically a kind of mechanism for monitoring discrimination, so that there's something kind of built into your plan around making sure that it's not discriminatory. Another issue is Medicare inclusion for counselors. Right now, Medicare only works with psychologists or psychiatrists or social workers. And so counselors cannot see Medicare patients. And so it would be, it's something that the NBCC is working on politically to try to change that language, to open up the door for counselors to be able to take those clients on. Licensure portability is another aspect of the NBCC advocacy work, and they have a portability statement where they have come together with a few different professional organizations, including ACEs and some others, to really make it as easy as possible for counselors to move from state to state. And so they've made some progress in that area, but certainly each state has its own licensure board, and it's quite a process, and they're working to make that a simpler process. Diversity and multiculturalism in research and practice is an ongoing issue for growth in our field. Much of theory and research has been very rooted in kind of white European culture, and that's something we need to be mindful of and continue to push towards change. We also are working on unifying the counseling profession through KCREP and through the NBCC, again, with some of the licensure work, but also kind of standardizing counselor education programs. So there's definitely some work being done there. There's more work to be done to unify supervisor standards. So right now there's not really agreement, and certainly every state does it differently as to who can be a supervisor and whether or not training is required for that. And that's something that I think needs to improve in our field. And finally, there's international mental health training, and the NBCC has a program called Mental Health Facilitator. You can see the website there. And they use that training around the globe to help not not for training counselors per se, but kind of a step down from that, kind of a lay person being able to be knowledgeable about mental health and kind of help assist to meet the global needs of mental health that we see. If you want more information, the website is there for the advocacy work that the NBCC is doing. And again, you see that reference to the gatekeeping article. Hope this has been helpful, and I'll see you next time.